as a geriatrician, I do understand the fear of losing capacity. I often see patients with loss of capacity, and it's something that can be difficult for the family and healthcare providers, informal and formal carers. So I think it's important to recall that the healthcare system is there for the patient, and we're able to provide good care as long as we go with good dementia care. What I mean by dementia care is to have a way of treating the patient by really knowing the patient, knowing the needs of the patient. To do so, we have to understand what causes the symptoms. For example, in dementia, we have behavioral and psychological symptoms of dementia that have to be treated. The way of treating those symptoms is to first understand where they're coming from. So if a patient wants to dance or sing or walk around in the whole institution, we have to understand why and what's the meaning of that. So we have to know the story behind that and understand what the symptoms mean. It's also important to know that with dementia, there are different medication that we can give to the patient if the dementia care, like basic dementia care, doesn't work. So it's important to, for example, if the patient is anxious or depressed, we have good antidepressant, or we have medication that can reduce the symptoms at least. Also, for hallucination or behavioral symptoms, antipsychotics can be used. So in dementia, we have different ways of treating the patient with behavioral and psychological symptoms of dementia. We have dementia care, we have medication, and there's a way to treat the patient empathetically so we are able to really help the patient. So to me, if we have the resources, the financial and human resources, then we will be able to care for patients with dementia and reduce that fear of losing capacity.